According to the CDC, the U.S. is in the midst of the second largest COVID-19 surge since the start of the pandemic. Experts are predicting that 100 million people, or 1 in 3 people in the U.S., may contract COVID-19 during this surge. So joining us today is Dr. Philip Levy, professor of emergency medicine at Wayne State University, and he is here to talk about the latest on the COVID-19 front and the potential impact of long COVID on patients. Thank you so much for being here, Dr. Levy.
My pleasure to be here with you.
Now, first of all, what exactly is long COVID and why do people need to know about it?
That's a great question. Long COVID goes by several different names: long COVID, long-term COVID, post-acute sequelae of COVID. But regardless of what you call it, it's a constellation of symptoms that develop in the weeks to months after people recover from the initial COVID infection. So you start off with COVID, you have a cold, cough, runny nose, headache, fever, body aches, what have you. That stuff generally goes away after a few days, but some people, a good segment of the population, as you noted, experience persistent symptoms, things like persistent cough or shortness of breath, or confusion and not being able to process information the way they did previously, something that has been termed brain fog. People may even experience insomnia, mood swings, anxiety. There's a whole range of symptoms that go into this, but the bottom line is that people are developing symptoms after having COVID that linger and persist, and it can be quite troubling for their regular, activities of daily living. Things like walking the dog or walking to the corner store to get, some food or something can be made that much more difficult if you're breathless along the way because of COVID.
Now, who is at the highest risk for developing long COVID?
So the people with the most severe infections when they get COVID are at the highest risk, but anybody can develop long COVID. It doesn't have to be people with severe infection, but knowing that, we want to try to avoid severe infection. So people with advanced age, comorbidities like heart disease, diabetes, or high blood pressure, we know are risk factors, but also is not being vaccinated. So unvaccinated individuals are almost twice as likely to develop severity symptoms and long COVID.
And when is the best time to get a COVID vaccine? And quite honestly, is it still worth getting vaccinated this late into the season?
Yeah, if you've never been vaccinated, the best time is now. And if you haven't had an updated vaccine within the past few months, it's also now. So we talk a lot about seasonal variation in respiratory illness. We know that exists for flu and the common cold, but it's not quite the same for COVID. COVID, people can contract it at any point in time during the year. So it's not too late at all to get a vaccine. And people should think about getting vaccinated about 3 to 6 months after the most recent episode of COVID or their prior vaccine if they haven't gotten an updated one. But about that 3 to 6 month window is when people should be thinking about it. But like I said, I want to reiterate, if you haven't had an updated vaccine or you've never been vaccinated, now is the time.
And where can folks go for more information?
So vaccines.gov is a terrific resource. It's been around since the early days of the pandemic. It has great information on COVID itself, evolving variants of the virus itself, and new and updated vaccines that continue to come out and are available for people. And they can also get resources on places in their neighborhoods where they can go get vaccinated, potentially even make an appointment to get that done.
Dr. Levy, thank you so much for being here with us today. We appreciate it.
Happy to help.